In the late 1990s, I had a doctor come to me, Dr. Kleinert, and she asked what people in Southwest Detroit do for healthcare. She made a promise that she would treat anybody I would send to her, and she would actually make house calls with me. She kept that promise over a series of years, and from that, energy built with several area churches and the Evangelical Covenant denomination to garner support to establish Covenant Community Care.
First year that I was here, we took care of about 1,000 people, and last year we took care of 16,000 people. The first year we provided about 3,000 patient visits, and last year about 50,000 patient visits. You know, we've grown a lot. We have 6 locations now. So, you know, the number of people that we've been able to bless just grows and grows. Well, we provide medical and dental care. In the medical realm, we have pediatrics, we have OB/GYN, we have internal medicine, family practice. We have lab services, which are donated by Beaumont Health Systems. So we really wrap around the patient from a primary care perspective. And then included in that, of course, is a tremendous dental clinic that we operate, which is really the premier safety net dental clinic in the city.
Our community here in Detroit has experienced a lot of difficulty over the years, battling blight in the midst of reconstruction. It's heartening to see people move into the city, truly visionary. At the same time, there are challenges that have remained pretty much the same. And a lot of our medical and especially dental challenges have been unaddressed for so many years that there's a tremendous backlog, and the mission of Covenant Community Care is very heartening to me. At the same time, there's an ethos in Covenant Community Care to treat every patient, every client, as if they're Christ.
There's a real sense among our staff that it's an injustice if someone who's sick can't get well. And we work against that injustice regardless of a person's ability to pay.
Dr. Kleinert had this idea of taking care of people without insurance, and Pastor Bob and others at Messiah were like, there's a whole bunch of people here that could be helped by your services. You know, there was a number of people that were working without insurance, and they didn't have a place to go. So I think it's kind of just matching a need in the community with another partner for Dr. Kleinert. So.
Because you're uninsured, that should not be a reason why you don't get quality health care. You're not treated fairly. So I think that really encompasses community medicine, and that's really what drew me into Covenant, because that's the only place I knew that care for uninsured patients.
It's a great thing for me to see each person who comes being treated with the dignity and respect that they deserve as a person created in the image of God.
It is a Christian-based organization. That was a big part of me coming here too, because I knew I could be open with my faith. I knew they supported me in that type of thing. And even if all the patients that come here are not Christian, that's not a problem, but I still offer prayer, and I think the patients really enjoy that aspect of it too.
What I love about Covenant is it's a team, that we're all working together for the benefit of the patient, and it's neat. That's really it's encouraging, it's energizing to be part of a team. With that being said, it's hard work. It's really hard work, and I think in my experience, the Lord renews you every day for that.
Sometimes it's the hardest days that you most are aware of the call. You wish that the world was easy to deal with, but the world is very hard to deal with. And when you can work your way through very difficult problems and know God is with you, you feel you're in the place that He wants you to be.
There's also a sense that people practicing medicine here are doing mission. And not just the providers, but the entire staff, the office receptionist, the benefit counselor. Each person in Covenant Community Care is embracing the mission of loving Detroit for Christ's sake.
Actually working with the people of Detroit, because that's always been a goal of mine, why I went into medicine, because I grew up in the city of Detroit and I always wanted to give back to my community. I saw there was a great need, and I just wanted to be a part of that. on a daily basis, my coworkers really encourage me to do better just with caring for patients, caring for myself, my walk with the Lord, and in my prayer life, and it's just an encouragement all around.
Today, I'm so encouraged to see a half a dozen sites in and around Metro Detroit, more than 100 staff, and a great array of medical professionals committed to meet the medical dental needs of the people of Detroit and to do it in the name of Christ.